Hello,
Hi.
my name is Kyle Albano. I am an NP student at Mass College of Pharmacy, and I will be conducting your physical exam today, including a mental status exam, your head, ears, eyes, nose, and throat, and also a skin exam. First off, can you tell me your name and your date of birth?
Madalena Albano, 3262.
Okay, good. And can you tell me where you are right now?
In the office.
Good. And what year is it?
2019.
And who is our president?
Donald Trump.
Okay, good. So I'm going to start off by just assessing your skin. Patient appears to be in no apparent distress, no visible rashes or lesions. I'm also checking the patient's capillary refill, less than 2 seconds. Also the elasticity and turgor of the patient's skin. Patient does not appear to be dehydrated. Ma'am, do you have any complaints today?
No, I do not.
Okay, good. So next, I will start with the head. So I'm examining the head, making sure that it is symmetrical, normal cephalic, checking the hair distribution on the patient's head. No lumps noted. Going to palpate for any tenderness. Any tenderness, ma'am?
No.
Okay, good. I'm also checking the patient's face for any wrinkles, also for symmetry. Next, I will be testing cranial nerve 7 and 12, which is the facial nerve and the hypoglossal nerve. So, ma'am, I'm going to have you close your eyes for me, squint. Good. Raise your eyebrows. Very good. Next, I'm going to have you puff out your cheeks for me. Good. Have you smile. Frown. Okay, good. So next, I'm going to be assessing cranial nerve number 5, which is the trigeminal nerve. And I'll be doing that by palpating the temporal mandibular joint. So now I'm going to have you open and close your mouth. Good. Any clicking there?
No.
Okay, good. Next, I'm palpating the temporal membrane. Good. Okay, so next, I will be also testing cranial nerve number 5, which is differentiate between a sharp and a dull object. So, ma'am, I'm going to have you close your eyes for me. And I'm going to have you tell me which object I'm touching your face with, whether it's a dull object or a sharp object, okay?
Okay.
What does that feel like?
Dull.
Okay, what about this?
Sharp.
Okay, and this?
Sharp.
Okay, good. The next cranial nerve I will be assessing is cranial nerve number 12. So which is the hypoglossal nerve. So I'm going to have you shrug your shoulders for me, ma'am. Good. And now I'm going to have you relax. And now I want you to put pressure with your shoulders up again. Good. Okay. I'm going to have you look to your left. Put pressure. Good. And now on this side, with your right. Good. Any pain there?
No.
Okay, good. So next I will be assessing the patient's eyes. So first I will be inspecting, so checking the conjunctiva, her eyelids, eyebrows, sclera, iris, lacrimal apparatus, and sac. I will be applying pressure. No discharge noted at this time. Next, I will also be testing cranial nerve number 2, which is the visual acuity, and I would use that by a Snellen chart. So I would have the patient stand 20 feet before the chart and have her read each line, and whichever line she's able to read will be her visual acuity. We don't have a Snellen chart at this time, so I will explain the procedure. So next, I would do the response to light, direct, and consensual, and also with accommodation. So that's cranial nerve 2 and 3, the optic and ocular motor. So by doing this, I will be using the otoscope at this time just for the light. So what I'm going to be doing, ma'am, I'm going to be looking, have you look straight at me, okay? Looking at her pupil, it is equal and reactive in both eyes. I will have you close one of your eyes, ma'am. Look straight at me. Okay, now do the other eye. Good, okay. Now I'm going to have you put both hands down, look straight at me. Now, pupil does react on the other side. Same for the left eye. Good. Next, I will be testing extraocular movement. which would be cranial nerve 3, 4, and 6. So first, ma'am, I'm going to have you look at my otoscope and just keep looking at it as it gets closer to you, okay? Good. Checking for nystagmus and ptosis. Next, ma'am, I'm going to have you look at this otoscope. Don't move your head, just move your eyes, okay?
Yes.
Good. Okay, next I will be testing her visual field. That's cranial nerve number 2 as well. So, ma'am, I'm going to place this behind you. I want you to tell me once you see this appear in your vision.
Okay.
Straight at me.
Mm-hmm. Stop.
Okay, good. Now on the other side.
Stop.
Okay, good. Very good. So next I will switch over to my ophthalmoscope and I will be assessing for the red reflex, optic disc, arterioles, veins, and macula. So first, ma'am, I'm going to have you look straight at me, please. I will also dim the lights before this exam. Okay. Adjusting the ophthalmoscope. I am able to visualize the optic nerve and arterioles. Next, I will perform this on the left eye. Okay, good. Okay, so next I will be inspecting the patient's ears. So with this here, I will be palpating the auricle for any tenderness or pain. Good. Inspecting for symmetry, which is good. Palpating. No tenderness noted, no discharge noted. Pink. No swelling noted. So I will be doing a few tests now. First, I will be starting with the whisper test, which is cranial nerve number 8, the acoustic nerve. So, ma'am, I'm going to tell you a word on each side, and I want you to tell me the word back, okay?
Okay.
So, okay, now, what word did I tell you on the left side of your ear?
Dog.
And now on the right?
Pencil.
Okay, good. So next test I will be performing is the Rhine test and the Weber test. I will be using my tuning fork for this. First test I will be doing is the Weber test. So I'm going to hit the tuning fork, place it on top of your head, ma'am, and I want you to tell me if you hear the vibrations in both ears. Okay?
Yes.
Okay, good. Next test will be the Rhine test, which I will place the tuning fork on the patient's mastoid process, and she will do the same.
Yes.
Okay, good. Okay, next I will inspect the patient's ears. First I will start off using my otoscope here. Start off with the left ear. So pulling down and up. Okay, I'm able, there's some earwax noted, able to visualize the tympanic membrane. Cone of light is at 7 o'clock. No discharge noted, no scarring noted. Next, I will assess the right ear. Pull back and up. Okay, some earwax noted as well. Temporal membrane, tympanic membrane noted. Cone of light at 5 o'clock. Next, I will be inspecting the patient's nose. Okay, so I'm looking at midline is symmetric. The bridge of the nose is symmetric. Checking for patent airways. Also the mucosa of the nose. Good. Good. Okay, no discharge noted. So next I will be performing a test which will be the sense of smell. It will test cranial nerve number 1, the olfactory. So I will place an item in front of the patient and she will tell me what the item smells like. So I have you close your eyes, ma'am. I'm going to place something in front of you. I want you to tell me what it smells like.
Cinnamon.
Okay, good. All right. So next, I will be inspecting the patient's mouth, lip, oral mucosa, tonsils, throat. Lips look moist. Can you open up your mouth for me, ma'am? Stick out your tongue. Okay. Tonsils noted. No swelling, no discharge. Hard and soft palate noted. Papillae present on the patient's tongue. Can you lift up your tongue for me? Lift up your tongue. Frenulum present. Okay. Teeth are intact. No foul odor coming from the patient's mouth. Oral mucosa looks intact. Pink and moist. Next test, I will be testing I will be inspecting the patient's neck and thyroid gland, but I will also be testing cranial nerve 9, 10, and 12 by having the patient swallow. So now I'm going to have you just swallow for me. I'm inspecting here. Good. Patient is able to swallow. Trachea appears to be midline. No deviation. All right, ma'am. Next, I'm going to step behind you. I'm going to palpate your thyroid gland, okay? I'm going to put my hands on the back of your neck. Okay, palpating the right side. And now palpating the left side. Okay, thyroid gland was palpable. This ends the exam. Do you have any questions, ma'am?
I do not.
Okay, thank you.
Thank you.